of like to try and use humor sometimes. I think people actually hear your message if you can make them laugh at you. And so what I said when I stood up is, I interrupt this so-called public hearing to bring you the following unpaid political announcement. Put single payer on the table. My name is Dr. Carol Paris, and I approve this message. And then I was arrested. I was looking right at John Kerry, actually, when I said it, because I just remember hearing him saying that so many times during the primary. My name is John Kerry, and I approve this message.
The biggest struggle for us through this whole thing is that the mainstream media doesn't cover the things that we're doing. Again, because of special interests and their advertisers. What we were trying to do at that point was to try to help people understand that the insurance companies are the problems. That just giving people health insurance is not the solution, because health insurance companies are for-profit entities that avoid the sick and deny and restrict care. So the idea of that campaign was to bring people to health insurance companies and ask them to stop denying care. That if a doctor prescribes care, they shouldn't deny it. If a patient has been paying their premiums and they need health care, they should have it paid for. One way to bring attention to the fact that you're making these demands is then to have people, sit in and
After I went, I'd been in jail, and I told this young professional guy about my experience, and he said, he says, 4 years ago, I had my wife was pregnant, and her water broke prematurely, and I had to rush her to the hospital. The doctor doesn't seem to detect any signs of life in her belly, so he immediately does a C-section, brings the baby out, and literally saves the baby's life, because the umbilical cord was wrapped around so she couldn't breathe, and she couldn't get any blood from from the mother. And when it came to getting the insurance to pay for it, they wouldn't pay for it because he didn't get a second opinion.
Wow.
How about that? Wow, what is this? So those are the kinds of stories, and I've heard those stories time and again, and it's enough to make your, if you're a human being, it's enough to make your blood boil.
I think people should think about the fact that healthcare should be a human right. We take care of our elderly, we try and take care of our children. We don't always do that, but why not everybody? Why does this have to be something that divides us? This should be something that unites us.